This morning in Family First, we recently talked about the surge in behavioral health care visits to the ER room at Connecticut Children's Medical Center. Why is this happening right now? There's a long list of possible reasons. Here to discuss, Dr. Laura Saunders is back with us from Hartford Healthcare's Institute of Living. Dr. Saunders, thanks so much for joining us.
Morning, Erica.
All right, let's talk about the timeline here. We're 18 months into the pandemic and counting. And that seems like a really long time for our kids, the teens especially, right?
Yeah, I think teens are feeling it a little bit more acutely. Not that it wasn't significant if you missed sort of a good chunk of 4th and 5th grade. I'm not certainly minimizing that. But I think teens, and especially older teens, are acutely aware of the milestones that they missed, the events, the football games, the other sports things, the proms, that they've missed a lot of things. So I think the older teens are really feeling it acutely. And now a lot of the, juniors and seniors have sort of college planning packed on. So it's really been a lot for our teens. They are overwhelmed. And they're showing it because we're seeing the numbers in the emergency room.
Well, let's talk about school for a minute now. A lot of the kids were excited to get back into the classrooms, and many of us viewed that as a positive. Some good news that the pandemic was allowing the kids to go back into the classroom, but unfortunately we're also seeing a negative side to that as well.
Kids belong in school. That's where they learn best. However, because so many different situations in so many districts, they were in school, they were remote, they were hybrid, they were back and forth. So kids lost the most critical thing about their lives, which is routine and structure, along with the fact that a lot of kids don't do well in remote learning. And so I think a lot of these young people are feeling the effects of missing chunks of information, not really able to take it in the hybrid format or the remote format. So they're entering classes now and they're in school and they're looking around thinking, uh-oh, are people missing as much information as I am? They're trying to mask it at the fact that they're really struggling, overwhelmed, and anxious because they're missing chunks of information, and then it comes out in other ways.
Now, our kids really have been dealing with such a tough situation. I mean, looking back, you and I would never have been remote in a classroom back when we were kids. And, before the pandemic, there were some people, even college age, struggle with doing online classes. So they've really been through a lot. And as parents, we try to have a grasp. We try to know what they're dealing with, what they're going through mentally. But we're not perfect. And sometimes it's really hard, especially when you're talking about teens. It's hard to grasp what they're going through. What are some other things that we really need to keep in mind with how they're feeling, what they're going through?
Well, for the most part, younger kids, and this is a generalization, but younger kids tend to be externalizers. If they're in distress, they externalize it, The older kids, the teens, tend to be more internalizers, meaning they are in distress, but they hold it in. You say what's wrong, and they're like, nothing, I'm fine, right? So it's a little harder to crack that shell and kind of get at what's really going on. So it takes a lot more work on the part of parents. And really, I think the great majority of parents did the best that they could during this pandemic because they were working and they were trying to be teachers and they were, they had multiple roles as well. But really trying to label and identify for your teens, are you feeling overwhelmed in school? Are your classes feeling hard to you? Socially, is it hard to get back in the swing? Sometimes the best way, because they are hard nuts to crack, is to open up about yourself. Role model that you're talking. Yes, I had a hard day at work today, but I'm going to try harder again tomorrow. To open up yourself and be a role model.
Showing them that you're not perfect, that you struggle with it as well, can really have an impact on them. Now, let's talk about what we should look out for as parents, what we should look out for as far as for red flags.
So we look for some of the classic signs of anxiety and depression based on what your child's vulnerabilities might be. So, excessive worry, loss of interest in activities that were previously pleasurable, withdrawal, like real true, not just like moodiness, I need time alone, but real true social and emotional withdrawal. You I do think it's always helpful to check in with school, check in with a guidance counselor or school support personnel, get their take on how your child's doing. If they seem to be doing okay in school and they're just being moody at home, I'm less worried about that if their difficulties are across settings.
Good point. You can always check in with school. They're there for so many hours a day. Now, before we go, I have to ask you about resources. Parents need to know that there is help out there.
Yes. So I always start with, often towns have youth services divisions. If you're in an urgent crisis, you can call 211 for emergency mobile psychiatric service. We try to reserve the emergency room for emergency issues. Someone is, in fact, a danger to themselves, a danger to others. Often pediatricians have lists of mental health professionals that they work with. So that's a resource also.
All right, Dr. Saunders, thanks so much. Obviously, it's still a difficult time for all of us. We do appreciate your help and your insight.
Take care, Erica.
You too, you too. And always an easy number to keep in mind, 211, that's the state's hotline as well. You can always call that and get some resources that are available there. And we hope you stick with us. We have a lot more coming up here on Fox 61. We're continuing to follow the breaking